Mehreen. I'm a VONGal from Orion Square. We started an initiative called the VONG Movement, which is Voice of the New Generation, and we work with the youth, and we basically bolster their voices and give them a platform to present their ideas and solutions to global issues. And we also provide them a platform to the policymakers and the civil society. And yeah, we're always looking for more Vongsters, the youth to join in, anybody from ages 13 to 18. If you guys are interested and you like to support the planet and save the planet, you guys can send us a DM or just register on our website. So today we're joined with Arjun and Dr. I'll just give a quick introduction about you guys. We're going to be talking about menstrual health and sustainability. So I have Dr. Abhinaya with me, and she is a consultant obstetrician, gynecologist, a surgeon, and she has started, along with her colleague, a Pink Butterfly project here on Instagram. She can sort of tell you more on it. And we also have Arjun from the Red Cycle, and you've been associated with them since 2015, and you manage their program. So if you guys could give a quick brief on what you do, respectively, that would be great.
Yeah, thank you, Mehreen, for the introduction, and thank you for having us on your platform today. I think I'm just hearing about your Orion Square, and it's so good the young generation is coming up and giving a platform for other people to join in and share their ideas. So basically, I'm a doctor, a obstetrician and gynecologist, and a laparoscopic surgeon. We deal with women's health issues, and I work for Care Hospitals, High Tech City. And during the COVID time, we were thinking what is a good way we can utilize our time, and just because the work was less and we were dealing more with COVID only at that time, and our work has become less. So then we started this page, me along with my friend. She's also a gynecologist. The page is called Project Pink Butterfly. We talk about the general women health issues starting from adolescence to menopause. See, women's body goes through lots of physiological changes like adolescent period, reproductive period, and menopausal period. And there are some things which are normal and some things which are abnormal. And in balancing their professional and personal lives, women tend to neglect things and get them go to the doctor late, and that things become haywire. So that's what we thought. We wanted to give a general idea of what is normal, what are normal periods, what are hygiene products. We talk about contraception, we talk about fertility, we talk about infections, sexually transmitted infections, and about the menopausal changes. That's what we are trying to give back through our page.
That's great. Arjun?
Thanks for having us here, Mehreen. My name is Arjun. I work with Red Cycle. I've been associated with Red Cycle since last 7 years. So we've been largely into menstrual education, and currently the Red Cycle is running a program in Kerala named Arthava Committee. Arthavam in Malayalam translates to menstruation. So it's a committee on talking about menstruation. So basically our intention is to build a campaign around menstrual education, which will allow pre-adolescents and adolescents to know about menstruation even before they attain their menarche. So it's a policy campaign that we have started last year, and it's going really good.
That's awesome. You guys, if you want to check out their respective Instagram profiles, we have that on our profile, so you can check them out. So I wanted to start off this discussion. So we're focusing on menstrual health, but also in rural and urban areas in India, because there's clearly a disparity. So starting off with rural areas in India, a lot of women and girls, they don't have access to even a toilet in their homes. A lot of women don't, so they have to go to a community bathroom, and so many other complex socioeconomic factors. And 88% of women in rural areas, they don't have access to menstrual hygiene products. So they end up using like newspapers or like rewashed rags, which it's not healthy because it can contribute to a lot of infections like urinary tract infections or yeast infections and a lot of other health concerns. So first, like I want to begin this conversation by sort of what can we do to promote a better menstrual hygiene over there in rural areas? Like what do you think can be done?
Sorry, Marin, this is directed at?
Anybody. It's the platform's open to
Okay.
anybody. Yeah.
Okay. Doctor, can I start?
Yeah, please.
Sure. Thank you. So while talking about promoting any particular menstrual product or investing in order to create access to menstrual product, before we begin with that, we need to understand what these terms stands for. Especially when we talk about investment, is that a monetary investment that we are talking about, or is it a social investment that we are talking about? If we're talking about monetary investment, then the next question is why only for menstrual hygiene? Why not for other aspects related to menstruation? Because most of the factors that facilitate menstrual hygiene are social factors or are certain political factors, and not just confined to product or anything that is related to market. Now, again, the question is if we are channelizing investment uh, to promote or if we are channelizing our investment towards menstrual health, then who is that benefiting? Is that benefiting profit makers, as in a few people who make profit, or is it benefiting the society as a whole? When we talk about the profit has a tendency of disrupting social movements. So here the issue is clearly a social issue. That is a fundamental thing that we need to understand. The issue is not just access to product. The issue is also how we perceive the biological process. The issue is also how we understand our body. The issue is also how we talk about it, right? How we accept the process. So whenever we talk about menstrual health, the discourse shouldn't be confined to menstrual hygiene. It should talk about menstrual health as a whole. Now, again, when it comes to investments, as I said in the beginning, investment shouldn't be just monetary. Investment should also be social. Now, what are these social investments? Firstly, educating people on menstrual health. Now, when we talk about educating people is not just to tell them to exercise informed choice, or it is not just confined to that. Informed choice or choosing a product is certainly their right, but we should also make them aware of their rights. What are their rights and how they can exercise their rights, and also how they can attain their entitlements provided under the current policy regimes, programs, or schemes. So here, investment should not just be confined to monetary aspect. And when we talk about investment in menstrual health, it shouldn't be confined to menstrual hygiene. So that's the point that I wanted to make.
Right. That's a great point. Doctor, do you have anything to add to that?
Yeah, and also it depends upon the awareness they're having. So people should know what, as he already mentioned, that this is a biological process and it happens to all menstruators, and every month it's going to happen. So it's not just the hygiene, they should know what is a normal menstrual pattern, what are the abnormalities, when they should reach out to a doctor, and should have the basic necessities for maintaining a proper menstrual hygiene. I think that's also important here.
Right. But why do you think that in rural areas, I mean, in urban areas, yeah, I think we're dismantling the stigma around menstruation. But why is it that we haven't been able to tackle these problems in rural areas? Whether it's like not just product related, of course, just awareness. Why is that still such a big issue?
Because see, in the society still these days also we see people who think menstruation is something impure, and people are like separated during those times, and there is still not, it is not an accepted thing that it's a normal process, and they feel the bleeding that comes through is impure, right? And they are just stigmatized. So that should go, this should start from early, and people should be aware of this. It's a normal biological process, and we should teach them since the early stages that this is normal. when this change comes, when the awareness comes, and the government also, it should be imparted in the education system also, not just it's a biological process. We just maybe will have a one chapter what's a normal menstrual cycle is, and there should be awareness among the boys also, not just the girls know about
Right.
what is menstruation. Everyone in the society should know what is menstruation and what menstruators to go through, and what are the normal hygiene products, and what are the basic water, soap, and disposable methods. Everything should be aware. So then only I think this problem can come down. The stigma around this should come down first.
Right. So I had another sort of wonderment because there back in the day, menstruation was not considered a stigma. It was not considered as impure. Women were actually celebrated for it and they were venerated. But somewhere along the line and like throughout time, the society that used to like celebrate women for like their menstruation and stuff, now it's considered impure and there's a lot of stigma around it. So where do you think like we went wrong and why did that transformation happen from it being to something positive to now being something negative?
Maybe the thing there, I suppose, was people were announcing it to the society that my girl is ready for marriage. That's the whole thing in celebrating like puberty functions. In the older days, the marriage used to happen very earlier, right? So maybe that's the thing, fundamental thing going on there. And yes, in those days also, people during their periods were asked to sit in a separate room. They were not asked to touch certain type of foods. They were not asked allowed to enter into puja rooms and all. And some families even are not allowed to see their parents or men in the family during that period. That is there.
Right. So not much has changed, at least in rural
Yeah,
areas.
but yeah, but I think
Yeah.
because it is globalized and people are moving around, they are traveling, there is a lot of interaction between people through internet and social media. People are aware, like there's a lot of awareness going on in the rural area also, but still much has to be solved.
Right. Another aspect that comes from menstruation that, women and girls they have to face through, like around 23% of women and girls, they're bullied due to their period and like unavailability of sanitation. So how can we, not just in rural areas, I feel even in some urban areas, there's a lot of bullying and like sort of that happening. So how can we deal with that situation or that issue?
Okay. Is that for me?
Sure, you can go for it.
Okay, so when we talk about sanitation, I think you had mentioned earlier that why are things not improving in rural settings and or as compared to urban settings. So from what we had observed from our sessions or our engagements with people is that things are same everywhere. It's not just in rural settings or urban settings or any tribal settings. Things are same everywhere. And there is a critical gap of information related to menstrual health everywhere. And when we talk about sanitation, then here the conversation should revolve around public health or public education. Because when you look at the private schools, the sanitation is proper. But when you look at the public infrastructure, that sanitation and things are lacking there. And when we talk about housings or settlements or land right and other land right conflicts or things like that, there comes the other schemes like SBM, the Swachh Bharat mission and its implementation. So there, the point is there is infrastructure. People are constructing toilets, but are we training people to use them? Are we bringing a behavioral change among people? So this is where investment again comes into picture. We invested in an infrastructure, but we didn't invest in social change. We didn't invest in social behavior, how people perceive it, or are people using them. Now, when we talk about public infrastructure, public health, and public education, why are the public schools, the schools run by the government, lacking sanitation majorly? Because they are not able to give the workers enough wage. Now, there comes the whole Pandora box. So when we look at it, so we have an experience working in Gujarat, there what we had noticed was people who come to clean toilets, they were paid merely 1,000 rupees a month. So by paying 1,000 rupees a month, can you actually sustain these facilities? That's a question that we should ask. So the reason is that when it comes to spending by the government, uh, when we look at the budget allocation by the government in the first place, the budget share for education is very less. When you look at the total, according to comparing it with GDP, the total allocation towards the budget is very less. And also, when it comes to spending, it is again, while it trickle down, the actual beneficiary is getting nothing. And when we look at the government schools, the situation is worse. So we should improve investments in this public infrastructure first in order to sustain them, because public education is really important. Most of the poor and the marginalized go to public schools, right? So
Right.
the public schools must be improved. And when we look at SBMs, again, investing not just in investing just in structures will not help. You should also invest in behavioral change and scale it up.
Right.
Yeah, that's what exactly I would like to say. So, see, we see government putting about a lot of interest, and they do construct toilets and all. The system is there, like the buildings are there, but the working is it actually going on? So he mentioned the right point that they're not paid enough. So they don't take the responsibility, right? So there is no one to ask whether the work is done or not. It's not that the toilets are not there, but are they maintained properly? Is the water
Right.
available there? Is the soap available there? Is the like the disposable, like for the sanitary products, are the necessary arrangements made? And how are these getting disposed later? So this is what, and he continues the bridge. He told us where the lag is coming from.
Right.
And also, you should pay the workers. The
Yeah,
government should pay the
Absolutely.
workers.
pay the
Yeah.
workers.
Absolutely.
Yeah.
Both of you spoke on like things that the government does or they're lacking. Do you think there's something, and I mean, of course, people like, you know, our organization and you guys are here to make a difference. What do you think the youth can particularly do to sort of aid to this problem?
See, like what you are doing, you're conducting awareness programs. You just take your time out. You are bringing people together and you're addressing the situation right. So, what I want to do as a doctor, I want to tell the little girls out there, like, 70% of the people during their adolescence don't know what is menstruation, when their first period can come, and what they can expect. Then obviously they're going to go through a shock. And all the mothers are aware of this process? Are they counseling their daughters or menstruators the right things, and like guiding them through the process? It's not happening. So what I would like to do is, like, whatever time, like whatever media I have, I would like to tell people, this is menstruation, this is the time you can attain your cycles, this is what you can expect in a normal cycle, and what are the hygiene products you have. And if you have these problems, you can use the simple medication. But if this is the problem is not solved there, don't affect your life, please reach out to your doctor, so they will guide you. This is what I can do. That is,
Right.
and I think Mr. Arjun can add on this, like how he works on this one.
I think we should emancipate people. We should organize them. We should tell them that, see, the government has so and so programs for you, and it is our responsibility to claim them, basically. So there are programs, there are policies, there are schemes, but how many of us know about these programs and schemes? So the reason why I mentioned profit in the beginning is also because profit never lets you know that there are these programs, and it never inspires you to claim these claim whatever is provided by the government, because they want to take the responsibility. They want to give it as a part of their CSR or other activities. But who is this benefiting? It is just expanding the market for them, and it is the question is whether it is helping people in the end. But
Right.
here we are considering profit as a necessary evil, and we are not completely disregarding it. So let them do what they can do. But the priority here is for the government. Government should do what they do the best, and people should be educated at large. People should be organized at large. People should be able to claim their rights on later stage.
Right.
And it's good to get profit by doing the right things, like giving the right choices to the people. Maybe that's what we are looking at.
So
Right.
it's not against a profit or anything, like anyone can
Yeah.
make profit. So we are not saying that
Yeah.
nobody can make profit, but the point is profit not at the cost of a complex social issue.
Absolutely. So COVID has been such a huge part of our lives, and how has COVID affected menstruation in women, or has there been like societal practices that affect the mental health of menstruators?
Yeah, COVID, yes, it did affect the menstrual cycle of women uh, in at many levels. See, first we thought the COVID itself, it has caused a lot of stress in the women, and then came in the vaccination, and it was blamed that people who are first it was told menstruators are not supposed to take the vaccine during the period. Then it just went like rapidly, and it's a bit, and then we told people everyone to take the vaccine, and people had disorders in the menstrual cycle. Maybe it can be because of the vaccine or the stress associated with COVID. This is one aspect of how COVID.
Uh,
I I think you're
Access
you
to.
can't hear
inaudible,
Doctor, no?
Doctor.
Hello,
Doctor, you
Now.
weren't audible since last 5 seconds.
can you hear me now?
Yes, yes, yes.
Yeah, now we can,
Yeah,
yeah.
sorry, I just got a call. So that's one aspect of how it affected the menstrual cycle. And next, could everyone access the hygiene products during this time? That's one issue that came
Right.
up. And how to when you are having COVID and in your cycles. So how did it affect you? Did you face any heavy bleeding and all? And could you access the medication required at that time? And because you are not allowed to go out, and there was a limited time where the pharmacies were opened, and maybe you don't have people to get out and get the medicines for you. So this is how
Right.
COVID affected us medically.
Right. So we have an audience question. How can awareness regulate menstruation hygiene be ensured in rural areas?
I
So
think I already, sorry,
yeah,
continue,
yeah, you
Doctor.
can continue, no problem.
Okay. I think we already addressed this. So we shouldn't differentiate between urban settings and rural settings here. There is absolutely no reason why we should do that. Um so from our experience, we have understood that in urban areas, the understanding of menstruation is as flawed as it is anywhere in the country. The thing is, the level of, I mean, the background from which a particular individual comes from can influence their level of understanding on menstruation.
Absolutely. Yeah.
So it is from individual to individual rather than from a setting to another particular setting. But definitely, the infrastructure in different settings can also influence in a great way how this is being perceived. But now we know that most of the cities, they're becoming largely cosmopolitan and very monotonous. Like there is no difference between any cities now. Like every cities look the same. So there is a large tendency to perceive menstruation as a very standard biological process. It's not standard. It's a very contextualized biological process. So from individual to individual, it changes because the way how body is designed and the way how people take it, their capacity to take it, depending on all those factors, the experience of menstruation differs. And also, you can see that from place to place, from region to region, based on the availability of water, based on the climate, based on the local culture and other various factors. Even language influences menstruation, right? The way how we communicate things with each other. So all these factors can influence menstruation. So you can't really say that for rural setting this should be the strategy, or for urban setting this should be the strategy. Even in an urban setting, if you're taking 30 people into consideration, 30 people come from different backgrounds, and
Yeah.
you can have urban poors also in that 30 people, right? So you can't have a standard methodology there. So it should be highly
Right.
contextualized and highly based on the needs of the people you are addressing.
Right. I think another big issue that both urban and rural areas sort of face is the disposable mechanisms for sanitary pads, such as like incinerators that's provided by the government. They're hazardous to like people, like women or like whoever is sort of, dealing with the disposal of those. So how could we sort of, work towards that to be a little bit more, to ensure safety within the people?
So for that, we need to go for sustainable menstruation hygiene products that can be used. We know like there's a lot of plastic that is being used in making the sanitary products, and
Yeah.
the for absorption of the plastic, it takes around 500 years. Like so, but if you go for a sustainable product like organic pads, the degradation time is only 1 year, right? So first we should bring awareness about menstruation and also about sustainable methods of menstruation, and we should tell the people how to dispose of these hygiene products. We see, and it's a reality that we see menstrual pads being thrown on roads. They are being
Yeah.
flushed to the sewage system, right? You can see them floating on the seas and all. So we can estimate how much has been dumped to see them like that. So they should be educated right from the young age, and they should be shown, they should be made clear how these should be disposed of, and they should be given what are the good options for menstrual hygiene. Like what are the
Mm-hmm.
sustainable options? We are not only looking at how to, what are the options you have for hygiene, we are also looking at what are the products which are environmental friendly, and we should protect that. That should be the thing.
Right. Right. What do you think is the proper way to dispose a sanitary napkin or, any sort of product?
See, coming from an individual level, so once the sanitary product is removed, it has to be covered on a paper or any cloth. Maybe we're using paper bags right now, but that's not happening. Everyone is putting in a plastic bag and disposing it off. That's the problem. So what we suggest is that use a paper bag and dispose it off in your waste. But we see in certain good companies, they have separate disposable bins for the sanitary waste, but you don't see that everywhere, right? In normal
Yeah.
offices or schools, that's not happening. So when that system is there, like the government makes it an initiative that every sanitary product should be disposed, and they are also in a dilemma whether to take it as a biomedical waste or a plastic waste, because
Yeah.
it has the blood and blood products, and it also has the plastic, and
Right.
medical waste is not tracked. So that's the problem coming here. So that should be, we should demarcate like what we are going to take it, and we should also tell them if the separate bins are there for disposing the sanitary products, and they can be like, we are using incinerators right now to dispose it, or like to burn them off, or but what's mostly happening is it's thrown on a big landfill and just left there, and during this process and the so many years of degradation and all, lot of bacteria is proliferating and a lot of infections are happening, and it's on a large scale. We don't know that this is happening, and during this degradation also there is a lot of microplastics entering our
Yeah.
ecosystem, and we don't know how much it's coming in our water or how much it's in our food products. That it's on a bigger issue to deal with. But in India, as of now, I don't think there's a proper separate disposal system for our sanitary products, and maybe it should start from there, and it should be mandatory everywhere, like how we dispose of our sanitary products, and then start off from there.
Right. Absolutely. Um, how would you define the relationship between menstrual health and hygiene and sustainable development goals?
Firstly, the idea of sustainable development for a developing nation like India should be, that should be thought upon because we are not developed yet. We are not there yet, right? So we are still in that stage of consuming a lot of goods, right? So when we talk about sustainable development, it may ask you to consume less, right, in order to leave less carbon emission or in order to have less byproducts. So here, really don't. know whether we should link it with the product aspect, but when it comes to gender equality and other aspects, there are a lot of factors which align with the SDGs. Now, when it comes to the product, also, I think innovation should be promoted. As you asked earlier, what is the right way to dispose a product? Uh, we should encourage more innovations in that area, and we should incubate those innovations uh, which are aligning with the asks of SDGs. And when it comes to education, like let's take the goals, for instance. When it comes to poverty eradication, or when it comes to gender equality, what are the fundamental things, or what are the fundamental target areas here? We can use the public infrastructure, as I mentioned earlier. Public health and public education can provide access to information, right? It can give access to health or universal education. So these are not something which are new. These were our demands from years, right? But these are not met. So for a developing country like India, we should focus on what are our demands at present, and we should meet those unmet demands of the present time. We are still not able to meet that. So before we meet those demands of the present, if we jump into the future, then that will not help us.
Right. Okay. So speaking of sustainability, how do you guys believe we can make period sanitary methods more sustainable? Like you guys talked about, like there's synthetic fiber in the products that we have now, plastic and everything like that. So are there any sustainable alternatives to these products that are like not, filled with harmful stuff for the environment?
Yes, we can talk about what are the different sustainable products available are. We have organic sanitary pads, which as I discussed, this can be degraded within 6 months to 1 year. There are menstrual cups. These are silicone medical grade menstrual cups. So menstrual cup is nothing but a small cup which you should insert inside the vagina and it collects the menstrual blood. It it once you buy it, it works for 5 to 10 years. Right.
Mm-hmm.
So compare it like a woman going through normal menstrual cycle and using maybe around 10 sanitary pads per day, like per her cycle, and they are using around 12 to 15,000 sanitary pads by the 450 cycles of menstruation they are having. And I'm telling you can use your menstrual cup for around 5 to 10 years. How much burden you are decreasing on the society and environment. It not only
Right.
works you out financially but also environmental level, right? And there is, it's not that, see, anything, it is like use and throw. You use it and throw it, the waste has to go out, but it's
Right.
reusable. You can sterilize it, you can boil in you can boil in water and you can reuse it again. So it's working for 5 to 10 years. That is one method of sustainable menstruation. And we also have period panties. These are washable and you can use it around 4 to 5 years depending upon the wear and tear. But the thing, and now we are again talking about the societal level, and as he told, the problems are same in rural and urban. So menstrual cup is something you can just clean it and put it inside, but when you're using any period panties, you have to wash them and then dry them properly, right? When you're again having the stigma of drying these products outside and all, it's not going to help. So these
Right.
are the different products available. You can, but coming to organic sanitary products, and again the cost factor comes here. It might not be accessible to everyone. It might not be financially friendly to everyone. But I think menstrual cup, once there is a niche of, once the people get how to use it properly, I have seen people are loving it, and it is so much environmental friendly that it decreases a lot of burden on the environment.
Right.
People should be, and awareness should be created why it is important, what are the harms caused by this normal plastic in containing sanitary pads, and how these sustainable measures can help the environment. We need to talk
Right.
more about these products and how to use them.
Right. Do you think there's a stigma on menstrual cups,
Yes,
or is it something
people,
that's being accepted?
there is stigma, there is acceptance, both are going on, and there is the learning curve is a little bit more. People should be aware of that. And there is the biggest question people ask us is, my daughter is unmarried, she's not like sexually active, can she use a menstrual cup? Does it break the hymen, which is like taught as the measure of virginity of the woman? If my girl inserts the cup inside the vagina, is her hymen going to get teared? All these questions come in place. So we need to address these questions. We can tell the mothers it's completely safe. Even unmarried girls, adolescents can use this cup. And once they start using it and get the niche of using it, they feel it very comfortable. So you need to address all these questions to the moms. So first create awareness among the parents, and then we should start it implementing through the, like in the education system also, we should tell them, and we should tell the environmental benefits it provides. It may be difficult, but I don't think it's impossible.
Absolutely.
Maybe it will take time.
Yeah. Arjun, do you have any other sustainable methods that can be implemented?
No, I think doctor covered it. And that's it. That's nothing to add.
Okay. I think apart from sanitary napkins, there are also a lot of products for like intimate hygiene or, just comfort for menstruation. Are those sustainable? Are they bad for you? What is the stance on that?
The question first starts is, are they safe? Are they good for you or not? So there is
Yeah.
this misconception, like they advertise these products as these are scented products. It gives good smell to your vagina. So first learn what is the vaginal smell. How can your vagina smell? It's not a flower, right, to bloom and smell like all scented
Right.
and all. So just know first how does a normal vagina smell. It can be musky or little fishy. That is the normal vaginal smell. Then you accept it. Now we go and see when you have excessive discharge and lot of fishy smell happening, that is abnormal. That's when you should reach out to your doctor. So then doctor examines you and tell if there is any infection. See, and people should also be aware that some amount of white discharge is common to any menstruator. This is because a lot of hormonal changes happening in your body. There are hormones like estrogen and progesterone. One hormone makes the white discharge very thick and egg white like, and one hormone makes it very watery, and these are the normal physiological changes that happen. So first you should be known of the fact. Now what are the abnormalities? You should know that any excessive discharge, that is like your panties are getting wet continuously, or if there is any itching or associated foul smell, that is abnormal. That is when you reach out to your doctor. Then they'll examine you. If there is any infection, they'll treat you. That's it. Please don't use any
Right.
intimate hygiene products because they are going to harm your body. First thing is vagina is self-cleansing. It cleans by
Right.
itself. There is no need to
Yeah.
put any products or any soaps or gels or perfumes inside the vagina and clean it. It's going to take care of
Right.
itself. So please let it do its work. Don't just
Right.
irritate it with all these products. This changes the pH of the vagina and invites infection. So
Yeah.
people who are making these ads and all, they're actually making a profit out of it. They're like fooling us. So first you learn how your vagina smells, accept that is normal. And if you have any of the problems I have mentioned, then reach out to your doctor. Don't use these products. And a lot of patients who come to me tell me that, madam, my friend used this product. She advised me this. I have taken this, but still my infection hasn't come down. It's going to
Yeah.
invite more infection. It's not going to help you in that way. So please know what is necessary, and please know what
Yeah.
are the abnormalities. Then only we can solve it. And a big no to all intimate hygiene products and scented products.
Right. So I think that automatically sort of insinuates that they're not sustainable either.
See,
Yeah.
there are some products which say they come from like it's all organic, we took it from the natural products and all. But is it really worth using them? Right? I'm telling you, your vagina is self-cleansing. So if it's organic
Yeah.
also, why do you want to use it? Right?
Right.
I'm telling if it's organic also, there is no need to use it. Either
Yeah.
it should be normal. If there is any abnormality or infection, let's treat it. Right? There
Right.
is no need of high maintenance for your vagina. It will take care of itself through
Right.
organic products or non-organic.
Agreed. Um, so there's a audience question. I think, Doctor, you could probably better answer that. People in India usually hesitate to visit a gynecologist. How can you sort of tackle that?
Sorry, people have a
People in India usually hesitate to visit a
hesitate.
gynecologist. Yeah,
There is no need to hesitate and all. We are just here to help you. If you have any queries, we are even on putting a lot of information on the social media platforms. If you really feel you need us, come to us. If you have any queries, reach out the right person, right? Not just your friend or someone. We
yeah,
are just studying, putting on maybe 10 to 12 years of efforts in just knowing what is right, what is good, and we call what we are practicing medicine. It's not like maths, 1 plus 1 is equal to 2. It doesn't work like that in science. So with our
right.
experience, we tell you what is good and bad. So I think that hesitance should go, right? Reach out to your
Yeah,
doctor when you have a problem. Please don't suffer. That's what I can say.
agreed. There was also another question, like we spoke about the government doing their job, like mothers are people doing their job. But what about the corporates? Like, are the corporates investing towards awareness and acceptance for sustainable menstruation? Because like they're the ones essentially creating these products, right?
There is a corporate social responsibility which every companies are obliged to do. And apart from that, we don't want the corporates to do the government's job because the government is already entrusted with certain tasks, and we want the government to do that. We don't want the corporates to take over it because after some time, the corporates will start feeling that okay, we are spending on everything, so why can't we be the government? And they will also come into the political arena. We don't want that to happen. So yeah, like if they have money to set aside, let them also invest in the process, but we will not let the corporates to disrupt the social movement which is happening on the other end. I also happened to see another question which is regarding the information dissemination before class 7th. That was a
Yeah.
really good idea, which is also connected to our work. So if I'm allowed to answer on that, I can
Yeah,
address that
absolutely.
right now.
Please do
Okay.
address it.
So firstly, the information with respect to menstruation is not disseminated at class 12th, I guess. In Kerala state syllabus, it's addressed in class 8th. And CBSE, I'm not sure. I think it's 8th or 9th. But the mention about the biological process is in a corner. It's not very visible. But I still remember in my school, they taught it really well. They discussed about the subject really well. And I still remember the day I was taught about that. But the question here is most of the students know about menstruation after they attend menarche. They don't know about it before they attend menarche. But we don't know how many of the students know before they attend menarche and how many of them know after they attend menarche. So there is a lack of data there. So firstly, we need to understand what is the average age of menarche among students. So we need to assess that. And then we need to know how many of them know before menarche and how many of them know after menarche. And then we need to assess from which sources they come to know before, from which sources they come to know about menstruation, whether it's parents, teachers, uh, through their formal education or their friends, media. Now most of them are using social media, so they might know it from influencers also. So we need to assess whether they know it from influencers or YouTube or
Yeah,
whatever the sources. Because with the increase in source of information, the quality of information might also get affected because
absolutely.
everyone will have their own versions of menstruation. Since I specified earlier, the experience of the biological process is different from person to person. So when we talk about it, when everyone talk about it, the versions of the story will be different, and that might ultimately confuse the students. So we don't want that to happen. So the best credible person here out there is the school and the teachers, because they're the consistent source of help for students, right? Now we need to look at whether teachers are trained enough to talk about menstruation in schools. Not just the teachers, we need to also talk about ASHA workers because they work closely with the families, right? So we need to look at the training and the capacity of both the teachers in schools and ASHA workers in the societal level. And there are programs already in order to train teachers and ASHA workers. There are different government programs which are directed at that. Now we should look at whether these trainings are happening. whether the ASHA workers are incapacitated or whether the teachers are incapacitated to talk about menstruation. Now, when you suggest an alternative to it, when you say that, okay, this NGO has a solution to it, or this company will invest in it, we are just shifting the responsibility from the government to a corporate or from a government to a non-profit. That is the very reason we don't want the companies or the non-profit to disrupt. We want them to help. We want them to be an ally in the process. We don't want them to do the job of the government, because then the people will start believing that, okay, the company is doing it, the government is not responsible for this. Now that is creating a field for the government to do away with their responsibilities. That is the very reason why the public infrastructure or the public education is not improving. So here the responsibility is firstly to assess the need of students and channelize all the resources that are out there towards meeting those demands, and then also incapacitate those infrastructure, or incapacitate the people, the human resources involved in that process, so that they can effectively tackle these problems. Now, yes, like when we talk about the students again, whether they should be educated before class 7th, in order to take that particular decision, we need to know at what age, what is the average menarche age of students, right? We can't just blindly say that from class 7th, they should be taught about this. Firstly, we should understand at what age people start getting their periods. What is the average age? Now, for this, we need to gather more information. So we need to start listening to people. We need to start talking, engaging with students more often, so that can all, I mean, it's a very lengthy process. So that is exactly what we are addressing right now as an NGO. So we are not providing anything now. We are not giving any product, or we are not giving any particular solution to it. We are in the process of learning what is wrong with the current policy regime.
Right. Doctor, do you have anything to add to that?
Yeah, I think that the normal age the women attain menarche is around 12 to 15 years. And if they attain menarche before 8 or 9 years, we call it as precocious puberty, and that can also happen. So maybe, yes, imparting education from imparting this knowledge from an earlier time, like during the school time, it would be definitely a wonderful area. And as you already mentioned, yes, we are talking about menstruation and all. I think we should add that what are the menstrual hygiene products that can be used. I think that's not taught in our school. We just teach it
Yeah.
as menstruation is a biological process. And one more thing, as Mr. Arjun has mentioned, that it's not the same for everyone. See, we as a doctors also feel that when someone says that I am going through my period, I cannot attend the work today. And there are people who say that that's a process that happens to you every month. Why are you making a
Yeah.
big scene out of it? Right. We do
Yeah.
hear such statement also. This is where we need to understand all menstrual cycles may not be the same for everyone, right? They can be suffering from disease like endometriosis, which makes them suffer with severe pain. And getting the cycle is a nightmare for them.
Yeah.
Like if a patient has fibroid uterus and they have excessive bleeding that even they change around 5 to 6 pads in like 4 to 5 hours, and they can't sustain on their work. So it's not just generalizing the thing. We are not telling that menstruation, yes, we are telling it's a biological process, and yes, it is not the same for everyone. We need to address the issues with that. We need to individualize it. And there are companies who also provide period leaves for their employees. I
Yeah.
think that is such a good
Yeah.
move. So we should
Absolutely.
impart it as a normal process of the society, and there should be acceptance. It's not that it's
Of
a general
course.
process, you have to go through it. There are some you should individualize the matter.
Yeah. Absolutely. I think it sort of all starts from like awareness and acceptance. Yeah.
Yes,
Um,
definitely.
do you guys have any final remarks you would like to add on? Any pointers before we wrap this up?
So
It is,
yeah, please go
yeah,
on.
yeah, Doctor,
I'll just
continue.
finish.
Okay. It is related to the previous question. Like, it was asked whether we can give it from class 7th. Now, the point here is, from even if we are starting it at class 5th or 7th for that matter, uh, that is a period when students are not even taught about their body. Uh, they are taught
Yeah.
about menstruation when they are taught about their body, right? So before they're
Yeah.
taught about their body, if we directly go to menstruation and other complex issues, then that might rattle the students because they are not prepared to learn about it. So the reason why the curriculum is structured in the way it is structured right now is a result of many studies, and it's a result of good research which is put in, right? So we need to also take that into consideration and try to understand why it is the way it is right now before we venture into something. And what we can do the best right now is like we need to find ways where we can talk about menstruation in an age appropriate manner. Like at different age, how can we talk about different, I mean, we need to create different steps where at every age this particular information should be revealed to that person, so that when that person gets menarche or when that person goes through the first menstruation experience, that person is not uh, is not going through the trauma, right? Is
Yeah.
taking it easily. So yeah, that should. I mean, there we should invest more in research and other activities. So that is exactly why we said the need assessment. And as doctors stressed, it should be very contextualized, because in every schools, the way it is dealt, or with every individual, how they consume the particular information is different. It all depends on their social settings. So we should
Right.
understand the audience better before we take all these factors into consideration. There is no simple solution to the issue. That is the
True.
conclusion.
Yeah.
Yeah, I think
Doctor,
that's
any
a
final
wonderful
remarks?
idea that we provide greater information, like at what age we tell about what is normal menstruation. We can tell about what are the different options available for this menstrual hygiene product, and the teaching about contraception also should start early. The society is changing. People are becoming sexually active at an younger age, and they come with unplanned pregnancies. So contraception should also be included. People should be aware of what are the options available to them. And I think the primary key here of today's topic, like menstrual health and sustainable menstruation, lot of thing revolves around creating awareness among the people, giving them the different options that are available and telling them which are the good among them, asking them to choose sustainable products. We can tell what are the advantages and disadvantages of each, and tell them how this benefits them and the society. That is what we should be doing right now. And I think
That
like
reminded me of one point. I'll add to it. Yeah, doctor, continue. I'll follow after you.
Yeah, and I think people like Arjun and many societies and lot of people also coming forward to create awareness about menstruation and deal about it. Like he's working at the level, like with the people, like he's telling
Yeah.
there is lot of stigma around it, and people are not ready to accept few things. And then comes how government is working and how private sectors are working on this. So these are the challenges we should address, and with with lot of support from various people and lot of awareness and using different media, we can definitely create awareness and educate people.
Absolutely.
The point that I wanted to add was that whenever we talk about information and dissemination of information, most of the times we send out conclusive informations, which never gives the scope of critical thinking, right? Which never promotes the scope of critical thinking among the students. So here, the students should be uh, able to critically analyze the information that comes before us. As I mentioned earlier, the sources of information are in plenty. So,
Yeah.
which information that they should trust is also vested. I mean, that responsibility uh, should be the consumers, right? Which information that they should trust. So, we should promote the habit of critical thinking here, which will enable them to analyze the information that come before them,
Yeah.
and which will also help them in the longer run.
Yeah.
Now, here comes the more complex issues like the menstrual stigma and other things, because it comes in many ways. Like if we are convincing a particular person to trust us, our narrative, then that won't sustain. That is not a sustainable solution here. Because another person might come tomorrow and present their version of the story and convince them. The person, the end user, will go with that person. So whenever we convince people on certain things, or whenever we are trying to disseminate information with respect to menstruation, especially scientific information with respect to menstruation, our objective shouldn't be to convince that person, because that will not sustain. Our role there is to develop the habit of critical thinking among that person, so that that person will uh, will think twice before consuming the information that we provide them, and a subsequent person might provide them. So that leads to the growth of an individual, right? That actually
Absolutely.
critically, that is the critical input to the growth of a particular individual. Otherwise, just
Yeah.
disseminating information, giving them lots of information, will not help a person.
True. Also, I feel like critical thinking is a very important skill to have in life. It will help you a
Yeah.
lot. Yeah. Thank you so much for giving such great inputs on this topic. It was lovely having you guys. If you could just share your experience with VONG, that would be great.
Yeah, thank you so much, Mefreen, for having us. And it's really nice to meet different people and like see what you are working towards and trying to make a difference in the society. And some of people are asking about precocious puberty. Yes, young innovators for society. Yes, precocious puberty. There are a lot of myths, and the incidence has been increased a lot. Maybe because of the foods we are eating. We are eating a lot of frozen foods. There are a lot of preservatives added, and we saw the. We also see that. The chicken we eat, the meat we eat, or the milk we are drinking, there are a lot of hormones induced in these animals, or for the easy growth and faster growth, and it is causing a lot of precocious puberty. And it's definitely an important topic, and it's a different topic. We'll take it
Yeah,
some other time and we will discuss
absolutely.
about it. And it's not only affecting the physical, it's also affecting the mental health of the girls, because they're attaining puberty at such an young age, and people start developing breast, and the way the people look at her changes, and it's going to affect her, and the height doesn't increase because the bones fuse at an early age. It's going to affect their mental health also. So that's a different topic, but an important topic. Maybe we can take it next time. And
Yeah,
I think I enjoyed the discussion and meeting all you guys.
thank you. Arjun, your some nice words about VONG for your
Uh,
experience with us.
Thanks for inviting us, and also thanks for creating such platforms which talks about the subject very often, which sustains the conversation around the biological process and its importance. And the idea is to learn more about things. The idea is to unlearn also. So what
Yeah,
I will be doing after this live is I'll go back and watch at the live, and I'll see what was wrong with my statements, and I'll try to improve that in the next session, like in the next live or anywhere where I'll be speaking. So for everyone, it was such sessions are a great source of inspiration to learn and to unlearn. So I consider this opportunity the same way.
great. Thank you so much for joining us. It was so nice having you two on the panel. Thank you.
Thank you.
Thank you.
Have a great day. Bye.
You
Thank
too.
you, Doctor.
Bye.
Thank you,
Bye.
Myron.
Bye, Arjun.
Thank
Thank you.
you. Bye.